What's up, everybody? Matt Vogt here, and welcome back to another episode of the Lifestyle Practice Podcast. As you may already know, here at TLP, along with my partners Derek and Steve, we are dedicated to helping you all, our fellow dentists, elevate your lives and careers through practice ownership. If you're someone who's looking to take your practice and your life to the next level, you might currently be an owner, you might be looking to be an owner, heck, you might be in dental school. Head on over to our website, thelifestylepractice.com, fill out our free lifestyle and practice assessment form, and Derek, Steve, or I will get back to you with some feedback on your current situation. No commitment necessary. We're not trying to sell you anything. We're trying to start a conversation. And if that means that we end up working together, awesome. That's what we love to do. But heck, even if it doesn't, we're going to keep bringing you podcasts. We're going to keep bringing you all the content that we know you all love to help you become better dentists and, again, elevate your lives and careers through dentistry. Today, I want to be very blunt on this podcast. And what I'm going to tell you is stop talking with your patients about teeth. And some of you may be listening to this and you may say, Matt, what are you talking about? That's what we do as dentists. We work on teeth. We help people with their teeth. Sure, that's what we do. But I want you to stop focusing on the teeth and the mouth and all the dental crap that we love to think about and talk about as dentists, and think about the person who's in your chair as just that, a person, a real, living, breathing human who has goals and desires and needs. An exercise that I love with my one-on-one coaching clients, it's probably the most productive thing, one of the most productive things we can ever do, is having those coaching clients run through their treatment plan presentations with me. I kind of hate to even call them treatment plan presentations in air quotes, but how are they talking with patients? And almost every single one, especially right at the start, has so much dentist jargon in it that it makes my eyes roll into the back of my head. And I'm not even a patient, I'm a dentist. So if my eyes are rolling to the back of my head and I'm wanting to fall asleep or cut them off, I can only imagine what a patient feels when we as dentists start to jump into this dental lecture or this explanation about biofilm or craze lines or blah, 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 when all they want is a solution to their problems. It is so easy for us as dentists to get caught up in all this minutia instead of focusing on what the patient wants or what the patient needs and explaining it in a way that relates back to those wants and needs for that specific person. So today, I tell you again, stop talking about teeth and start talking about how you're going to make your patients' lives better. You will see your practice take off. Your treatment acceptance will be on a rocket ship upward if you are looking at yourself as a person who solves problems for others and not just a tooth fixer. So let's run through a couple very easy examples of ways that you can do this. You can stop talking about teeth and start framing the things that you can do for patients in the context of their goals and wants and desires. A patient comes into your office with a bunch of old, massive occlusal amalgams with marginal ridge fractures, and you can see them plain as day. You know those teeth are ticking time bombs. You know those teeth need crowns. So you jump into a lecture of sorts once you've done your exam of why those teeth need crowns. Mr. Jones, I want you to take a look at this picture here. This is a very large, old amalgam filling. And when we see these cracks in the marginal ridges of the teeth, it is very likely that that tooth could crack in the future. And so I would recommend a crown for this tooth. A crown is made out of zirconium. Zirconia is one of the strongest materials that we have in dentistry. We use a lab, actually a local lab, with Jerry, the lab tech's name, and he makes the best fitting crowns for your teeth. This crown will be very, very strong, and your insurance should cover part of this procedure. My team can let you know what that will cost, and we should be able to get you scheduled here shortly. Do you have any questions for me? No? Okay. Well, I'll see you then. You have a nice day. Okay, that's a bit of an exaggeration, but I can't tell you how often I hear treatment plan discussions that sound very similar to that. And if I'm a patient and I'm sitting in the chair and I'm hearing this, my eyes have glazed over within 5 seconds. So when I tell you to stop talking about teeth, let's back up a second. In this specific example, which you probably will run into in your practice today, if you're listening to this on your way into work, did we ever ask Mr. Jones goals? Did we get to know why Mr. Jones is even in the chair in the first place? Let's assume he's a new patient. So let's get that out in the open first. Mr. Jones, what brings you in today? Mr. Jones might tell you that he is in pain. He might tell you he just wants a cleaning. He might tell you something a little more serious. He might tell you he had a friend who had gum disease who ended up having a heart attack, and he learned that that can contribute to cardiovascular issues in the body, and he's scared of that. You need to understand why your patients are in your office. That's number one. And I know a lot of us, as we go through the reps each day and as we get into a routine, we tend to start thinking of see problem, fix problem, see tooth, fix tooth, and not actually asking these questions or getting to know what's important to our patients. And the reason that's so important is because the way that you would talk to a patient like Mr. Jones about their fracturing amalgam and the crown that's needed on that tooth will vary based on why they're in your office. If they're there because they want peace of mind and security because they don't want to break any teeth, you can address that. If they're there because they told you they love to eat steak and that's their favorite food and they want to do that for the rest of their life, well, I sure hope you talk about that. Maybe they're there because they are concerned about how things look, and you can help them understand how a new crown will benefit their tooth, but also help it look better. You need to understand why your patients are in your office in the first place. And once you understand that, you'll be able to help your patients, tell them how you can help them and what they need in the context of their goals. And that will allow you to stop talking about teeth. Patients don't care about teeth. They care about how you can help them with their problems. So instead of talking about marginal ridge fractures and broken cusps and 60% of the occlusal table being occupied by a filling, therefore the tooth needs a crown, maybe you talk to Mr. Jones like this. Mr. Jones, I'm going to pull up a picture of this tooth here on the lower right that I am concerned about. You had mentioned you were here because you wanted peace of mind and you didn't want to lose any more teeth or break any more teeth. This tooth needs to be protected in order for us to accomplish that goal. We're fortunate that it hasn't broken yet. You can see these cracks starting to form. I couldn't tell you when it might crack or break, but this is a sign that it's heading that way. We really need to put a crown on this tooth, which will make it very strong and help support the tooth so it doesn't break and you can continue to eat the foods that you love and chew with confidence. And we really should do that now before you end up needing a root canal or we wait too long and that tooth breaks and we need to do something more drastic or even need to remove the tooth. Now, was that the most eloquent discussion in the world? No. And yes, I still talked about the tooth. Okay. But that discussion versus the first one was centered around Mr. Jones's desires. It was centered around his goals. And it was made very clear what he needs to do and why he needs to do it now. That's not saying that you're hard selling or you're forcing the patient to get things done or you're pressuring them. You're just being honest. Be honest with your patients about what can happen if they delay needed treatment. Here's another example, and I've fallen into this trap in the past quite a bit. You're talking to a patient about clear aligners, and we as dentists know that cosmetics are probably reason number 10 on our list of important reasons to align the teeth, right? We know the importance of balanced occlusion for overall health and how that affects the airway, especially in developing or growing humans or teenagers. We know all of those important things, and we know that looking good is maybe last on our list. So when we talk about clear aligners, it's really easy to start to talk about the process. We're going to take a scan or an impression, and we're going to send those impressions off, and we'll get your trays back, which you'll wear for 2 weeks at a time, and we'll place these attachments or buttons on the teeth. They're clear, blah, 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 blah. You start getting into the jargon of the intricacies of the procedure, and again, your patients don't care. They have to understand some of the details, and we have to have consent for the treatment that they need, sure. But they just don't care about the nitty gritty, oftentimes, of anything that you might recommend for them in your office. What they care about is, how does this help my life become better? How does this address my problem? I had a patient, it was a older gentleman in his 60s or late 50s, I believe, and he presented to my office with a ton of occlusal wear, and he was on the track for needing full mouth reconstruction, but it wasn't necessarily to that point yet. And I could have jumped into this big presentation about the wear on his teeth and the necessity of occlusion and blah, 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 and let his eyes glaze over. But by asking questions, we learned that this gentleman had recently lost his wife to cancer, and he was getting back into the dating scene, and he felt self-conscious about his smile. So when we're talking about clear aligners with this patient, we are letting him know the end result. We're telling him how we can help him feel confident again, how his smile will look different, and what he'll love about it. We're asking him questions. What would you change? What aspects of your smile do you want to adjust so that you can feel more confident? We're having this beautiful discussion, this beautiful collaboration that ends in him receiving treatment that he wants and that he needs. And it's all relating back to why he's at our office or why we're having that discussion in the first place. If we had jumped into talking about occlusion and how clear aligners work and all of that junk, we'd have lost him. We'd have just lost his interest, or he would have felt like these people aren't really listening to me. They're not really hearing me out. Don't feel like you have to discuss every intricacy, every dental aspect of everything you do in your office. Some people just don't care. Most people don't care. And instead start to think about the results of what you're doing. What does the patient gain from what you're talking about? In this case, this patient was going to gain an immense amount of confidence. He was going to gain health benefits, sure, but he was going to love the way he looked. He was going to love what he saw when he looked in the mirror every morning after he got out of bed. And that's priceless. It really is. Mr. Jones, that patient before who needs a crown on his tooth, he doesn't care about what materials you use. He really doesn't. He doesn't care about your lab. He doesn't care. I mean, it's important to figure out the cost of treatment and help him with his insurance, but he doesn't really care about that. He cares about being able to eat confidently again and not have to worry every time he bites into something hard or crunchy or chewy. That's what he wants. An example of this that I went through personally was a few years ago when I got LASIK. And awesome. I mean, it worked out wonderfully for me, and it's one of the best things I ever did. But I was hemming and hawing over it for a while, and then it was between Christmas and New Year's one year. I just said, you know what, I'm going to do it, or I'm going to go for the consult. I didn't even know if I was a candidate at that point. So I went to this office that had been recommended from a friend, and they did their initial exam. The doctor came in and talked to me and said, basically, you're a great candidate for LASIK. Here's kind of the very brief gist of the procedure. And then the doctor, I'll never forget it. He asked me, do you want more detail? Do you have any questions for me, or are you good to go? Something to that effect. And I love that because I didn't want him to go through the whole procedure. I didn't want to really know what he was doing, cutting my eyes, using a laser. I still don't even know what he did, honestly. I really don't know how LASIK works. I know there's a laser and they used to use a knife and something with the cornea. I don't really care. I just wanted to be able to see. And I also wanted to know when I'd be able to see. I think that might have been the one question I asked. And he said, yeah, your eyes will be dry for X amount of time. I had a wedding to go to actually it was New Year's Eve that I had it done. And I had a wedding to go to that night. And he said, yeah, I mean, you can go. You'll be uncomfortable, but uh, yeah, I think you should be fine. I asked him a couple quick questions. I wanted to know nothing about the jargon of the procedure. And he didn't jump into telling me about that jargon. It was beautiful. And I felt listened to. And I want you to take that same concept to your dental practice when you're talking with your patients. This is not just about you either. This is about your entire team and your entire office. I'll use my LASIK example again. After I spoke with the diagnosing doctor, I spoke with the financial coordinator, who gave me a very succinct treatment plan presentation and let me know what it would cost. It lasted about a minute and a half. She gave me a packet. It had the information about the doctor who would be doing the surgery, said he'd done like 50,000 LASIK procedures. She said, "Oh, he's awesome. You'll do great. You'll love him." Cool. That's all I needed. I didn't need any more detail than that. But I love that she endorsed the doctor. Whether she was told she had to say that or not, I don't know. But it sure felt like she was being genuine. And then she didn't jump into a big, long presentation about, oh, here's what your insurance will cover, and we'll submit your claim. And here's the discount that you get because we're in network. And here's the payment options that we have, blah, 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 blah. She just told me how much it was going to cost, said that I could use credit card or cash, and asked if I had any questions or wanted to discuss any payment options. I said, "Oh my gosh, thank you for not going into this big long story. I didn't need to just sit here and nod my head while you talked. No, I don't have any questions. I understand what I need to do. Thank you." And then I was scheduled. She gave me a few details about needing a driver, when to show up, confirming my appointment, etc., and I was out of there. Not all your patients are going to be like this. Some may be, and some may need a little more handholding and a little more detail. But give your patients the respect of listening to them and framing your conversations based on their desires and the reason why they're there in your practice. Don't go into your practice every day on autopilot and start talking about occlusal anatomy and craze lines and bone levels and calculus and all that stuff that patients just don't care about. How can you help them gain confidence? How can you help them not lose their teeth? How can you help them chew and eat their favorite foods for a lifetime? How can you help them be around for as long as possible to spend time with their grandkids or their great grandkids? These are the questions that you need to be answering as a dentist. And here's what's really cool about focusing on the person and not focusing on or talking about teeth, teeth, teeth. This is a fulfilling way to practice dentistry. When you get into single tooth carpentry and do that day after day after day, it sucks. This is not an easy profession by any means, and it's not made any easier by just becoming, honestly, a highly paid tradesman where you're just looking at tooth, fixing tooth. But when you are focused on helping people and you get your team on board with that too, awesome things can happen for your practice and your career. Your practice and career will skyrocket to the next level. And we're not even, I mean, we're talking about production and collections here, I guess, but we're just talking about your fulfillment and your ability to help people. The sky is the limit when you start to think about helping patients in this way and not just focusing on teeth, teeth, teeth. So today, when you're in your practice, stop talking about teeth, please. Talk to your patients like people and figure out how you can actually help them. Figure out why they're there because they didn't wander into your dentist's office for fun. Why are they there and how can you help them? And talk to them in that way. And I guarantee you, you will see your numbers get better, your fulfillment get better, and your practice will be much, much better as a whole. I wish you all the best, gang. Go do awesome things for some people today. Reach out to me if you want to start a conversation, if I can help you, if you have questions. My email is matt@thelifestylepractice.com, or you can go to our website, contact us in that way, reach out. And I look forward to hearing from you all and talking to you again on the next episode. We'll talk to you guys again soon. Take care.